1967, it was discovered by chance by Dr. Andre Mister. He was trying to cure cancerous cells with the laser. He was hoping that he will do something really amazing. But the problem is that he wasn't able for sure to cure cancerous cells with lasers because it's not that simple. But he found as a discovery that there was somehow a stimulation. So he was stimulating rats or mouses, and he found that when he was using the laser, there was a stimulation effect. No treatment of cancer, but stimulation. So he wrote about this without understanding the mechanism of action. He said somehow there is a stimulation effect. Let's try to use it in other indications, but we don't know how it's happening. So this was in 1967. And then it started to obtain recognition more and more in the medical schools, journals, publications, and from many from many cases, you can start to do a clinical study. From many clinical studies, you will do a systematic review or meta-analysis. And when we have enough evidence in systematic review and meta-analysis, you will have guidelines. So today there is guidelines for the use of photobiomodulation in many indications. 1967, failure of the skin cancer experiment. In 1983, the first proposed mechanism of action of photobiomodulation was discovered, and this is what we are going to give you today. So just to show you, and this is a screenshot. I remember until 2020, I think, when I type photobiomodulation therapy on PubMed, I have more than 6,531 results. And note that photobiomodulation was previously known as low-level laser therapy. So if you type low-level laser therapy, you will have more results. In neurology, brain damage, and physiotherapy, etc. Okay, so there's a lot of indications. The definition of photobiomodulation is the non-thermal use of the laser or the light with specific parameters and specific protocol in order to have a clinical action that is, of course, in our advantage. So this is how I say the definition. It is a non-thermal therapeutic use of light in order to positively modulate biological activities, stimulate or modulate. So this is photobiomodulation. If you remember when we were talking about the diagnosis and I showed you some cases, I told you it's not really complicated. It's fine if you don't follow exactly the protocol, increase the power a little bit, move whatever you want, you just have to see. In photobiomodulation, it's completely different. You have strictly to follow the protocol. Not only you have to follow the energy density that you have in this study or this study, you have to follow all of the parameters, okay? So here you have to be strict. And I will give you today all of the mistakes that I see in photobiomodulation in order for you to start doing it correctly and to have many positive results, okay? Which wavelength in our laser we have to use for photobiomodulation? Based on many studies, they've chosen the 635 nanometer. Why? First of all, because it doesn't have a very strong ablation, so it goes into depth. And this is exactly what we want in photobiomodulation. We want to stimulate. We don't want to cut. So we don't want a wavelength like the 980 that will cut. We want to stimulate. And also because it was found that this wavelength is well absorbed by the chromophores that we need to absorb. We need to stimulate. Okay, so it is well absorbed by things like hemoglobin, etc. These are the things that we want to stimulate. It is very precise, and it has it will target, as I've said, the chromophores exactly that we want to target without causing any other side effects of thermal damage, etc. And here, the advantage is that we have the special accessories that we need. So you can stimulate with a fiber of 200 microns, fiber like this. But first of all, you will take forever. Secondly, you're not controlling. Maybe your hand is moving a little bit. Maybe this area was already stimulated and you are stimulating it again. So with other devices, it might be very complicated because they didn't think of the special tips that will allow us to have easy and proper treatment. Okay, you get my point? So the accessories are helping us. They are very precise. Now histologically or cytologically, we have to talk a little bit of the mechanism of action. It was found that photobiomodulation, so the light, if used correctly and in the correct parameters, can stimulate something called cytochrome C oxidase. Cytochrome C oxidase is an enzyme inside the ATP, inside the mitochondria. Okay, this enzyme, if we stimulate it, we will have better ATP production. So we will stimulate the ATP production. And as you already know, because all of you are dentists, ATP is the living energy, okay? So it's the gas for us. ATP is the living energy. So the most importantly, photobiomodulation stimulates cytochrome C oxidase. It also caused a short and reversible burst of reactive oxygen species, ROS. This will allow to accelerate inflammation. So the process of inflammation will be much faster. So we will have much faster healing, okay? And it stimulates the formation of NO. So, stimulates cytochrome C oxidase, causes a short burst of ROS, stimulates formation of NO. NO, where nitric oxide is in the mechanism of pain, so it will also attenuate pain. This is microscopically on a cellular level. What's interesting for us as clinicians in our clinic is what is clinically what will happen. Okay? So for us, clinically, photobiomodulation will mitigate the inflammatory process, will enhance tissue reparation, will decrease pain, and will increase wound healing and tissue regeneration. Okay, mitigate, it reduces the inflammatory process. So really this is everything that we need in dentistry, okay? In a lot of giving situations, when we do our surgery or whatsoever, we want to wait for the healing. We want to reduce pain. We want to have a tissue repair in some pathologies. So this is where we can use photobiomodulation. Okay, to achieve a clinical outcome, if you are hoping that to have a positive result, you have to have optimal energy calculation. So as I've said before, the calculations of the energy must be optimal, okay? Exactly as the protocol that you are following. Energy density, but also power, time of irradiation, the tip diameter, the areas of irradiation, etc. Why do you think the Smart M Lasotronix has chosen the 635 nanometer? It's not by chance. They did the studies and they found, according to international recommendations and guidelines, some area in the electromagnetic spectrum are better absorbed by the chromophores that we want to stimulate. Usually 635 nanometer is one of the best wavelengths, and another wavelength that maybe one day it will be added to the laser machine. Why also I personally chosen Lasotronix or Smart M for the photobiomodulation? Because of the accessories that will help me, okay, that will make things so much better for me. And finally, because with time, when I become expert in photobiomodulation, maybe you in few months, you want to play a little bit with the parameters, and you have the possibility to play with whatever parameters you want, okay? Today, I press on any photobiomodulation, I don't care anything, and I put my own parameters, okay? These are the indications, clinical indications that we are going to see today. Cancer patients, nerve injury, can we do something? Papilla regeneration, TMG disorders. Maybe here you are asking about distance, right? Limitation of mouth opening. Okay, so, and TMG disorders. Pain management and osteonecrosis of the jaw. So we will start with cancer patients. What are the complications that we can find in cancer patients? Usually the most common one is oral mucositis. 80% of people that will underwent chemotherapy will have oral mucositis. 80% of the people that will underwent head and neck radiotherapy will suffer from oral mucositis. These are the other complications: dyschezia, so taste alteration, oral dryness, hyposalivation, inflammation of the skin, and etc. Okay? Do you think that there is international recommendations to use photobiomodulation? Yes, according to the Multinational Association of Supportive Care in Cancer and according to the International Society of Oral Oncology, they support the use of photobiomodulation for these complications, especially for oral mucositis. So, experts from all over the world, they did a multidisciplinary panel, and they came with protocols that I'm going to give you today. And I've published personally 3 or 4 studies, some of them are case reports, about photobiomodulation for cancer patients. So here, for example, chronic dysphagia. Dysphagia is the impairment of swallowing, okay? The patient will have problems swallowing. And oral mucositis, inflammation of the mucosa, dysphagia, oral dryness, taste alteration, and burning mouth sensation, and oral mucositis, dyschezia, and oral dryness. So, oral mucositis is defined as the inflammation of the oral mucosa caused by chemotherapy and or head and neck radiotherapy. According to the National Cancer Institute, there is a classification of oral mucositis. It's always important to start with classifying your case, okay, the grade, and then to do the treatment, and then to do the classification again to check which grade or state. I just want to tell you that according to their classification, the National Cancer Institute, the severe case of oral mucositis can cause death because he won't be able or she won't be able to eat, severe pain, etc. So it's something serious. A 53-year-old female was referred to the clinic. She had severe mucosal pain, significantly impacting her ability to eat. She was taking a chemotherapy medication. The quality of life was so bad. And in general, these patients, their main problem sometimes is the quality of life. Maybe they know that they will live certain years, but at least they want to live these years eating and living normally. So the quality of life is a big deal for them. This is the protocol. Now that you understood the mechanism of action, clinically, what will photobiomodulation give us? This is based on scientific evidence. This is the protocol. So, photobiomodulation is better applied each 48 hours. Okay, we were discussing today. Each day it's possible and it will give results, but each 48 hours they say that it's better because when you do a session, you will leave the tissue to repair, to heal the effect, and then you will do another session after 48 hours. Okay, so each 48 hours. Disinfect before because you want really the energy to be absorbed in your targeted tissue. You don't want the energy to be absorbed by some calculus or some stain that he has on his cheek. Cover the entire area of the affected tissue. So you can use either this tip or the other tip. There's a larger tip. Always work in a contact mode and never move your hand during photobiomodulation. So this is exactly how I have to cover the area. I will work here. When I finish, I will change and I will work in another area. If you are working Even experts, they do this mistake. They do the photobiomodulation like that. So they move their hands while they are doing photobiomodulation. What's the biggest problem in this kind of protocol? Why we don't have to move our hands during photobiomodulation? Saturation? Concentration. Concentration of what? Why we don't move our hand? You see, I choose and fix it.
Maybe for a few seconds it has to be there so that it reaches there.
Yeah, exactly. It's very similar to what you are saying. I did all of, and really, even experts, they do this mistake in congresses. And when I'm doing all my calculations, I say I want 4 joule per centimeter cube per centimeter square on this area. Okay. So I start to move my hand. Energy is equal to the power multiplied by the time, we saw it yesterday, divided by the surface. I want it 4 joule because I want to follow the recommendation. This is how much is needed for the tissue. I'm moving my hand, okay? So now the surface is changing. And it's changing in a way that is not accurate. So how am I won't be sure now that exactly 4 joule per centimeter cube were absorbed by this targeted tissue. So as you said, you need all the energy to be absorbed, and also you don't want to overpass. Okay, so maybe I did 4 joule here, and I'm moving my hand, and here at the end I obtained 8 joule, and 8 joule is not what we need. Okay, so don't move your hand. These are the parameters for oral mucositis. Remember always when you are making calculations, consider the tip. Maybe I can give you an example here. Okay, so here, if you can see, I want, for example, 100 milliwatt, 5 joule per centimeter cube. So the machine will tell me immediately that I need 25 seconds. Okay. If with this tip, so this is correct. This is the tip that I want. Okay. If, for example, by mistake, I was pressing on this and I'm using this tip, all of the calculations will be wrong. Here it's telling me I need 50 seconds for exactly the same protocol parameters. Why? Because I changed the tip. Okay. So the tip must be exactly the same in order to have accurate calculations. So this is only after 4 sessions. Remember when you asked me about lichen planus, how do we have to? It's exactly the same because it's photobiomodulation. Remember when we compared corticosteroids? Okay, it's exactly the same. So these are areas of irradiation. So external and internal, intraoral and extraoral. Perfect. We have tips for extraoral. We have tips for intraoral. In order not to waste my time, when I'm working extraorally, I will use this tip. It has another. Yeah, I will use this tip. Okay, this is perfect extraorally. If I want to irradiate this muscle, for example, temporalis, I need larger area of irradiation. Okay, it will be faster. If I want to stimulate something that is very thin, I will use this tip, okay, a papilla, for example. This is a thin tip, and in normal cases I will use this tip, 8 millimeter, 14 millimeter, 8 millimeter. Okay. So these are the area of irradiation. This is for taste alteration, exactly the same protocol, same parameters, but here different areas. Okay.
Minimum how many sessions?
Exactly. Usually 3 sessions per week. That's what a person will do, and then I assess. If there's an improvement, I do 3 more sessions, and then I assess. Sometimes it's enough in 4 sessions, sometimes after the 2nd session. It depends on how severe is the case. And before closing the subject of cancer patients, I can tell you something very important. Ask the oncologist that you will work with to send you the patients before the symptoms, okay? Because photobiomodulation can be made as a curative approach, also as a preventive approach. So if they are convinced when they will start to have positive results, they will start to send you patients before head and neck radiotherapy. So before the patient starts, he will send you the patient and you will do preventive sessions. So the symptoms maybe will not even appear, okay? Hyposalivation, and that's for cancer patients. Now, concerning nerve injury. I've published a study found in PubMed about photobiomodulation in a patient with an alveolar nerve, lower alveolar nerve, inferior alveolar nerve damage. Okay, this patient was referred to me after 6 months, I think, from his iatrogenic accident. He was, the dentist was removing surgically his wisdom tooth, and this iatrogenic accident happened. So after 6 months, they called me and they asked me if I can do anything. I told them, honestly, I don't know, because after 6 months, I don't know how, if we can still regenerate something or repair something, but I will try. And I told the patient that I will try. I'm not telling you anything. I was very impressed by the results, and I decided to publish this study. Let's read a little bit. Okay, first of all, it's frequent. We have 300,000 cases per year. 0.12% of them will persist permanently. So 360 cases per year. So 2 years ago, one of these cases was in Lebanon because this patient was referred to me. And the surgical solution usually are very hard to do a nerve surgery, etc. Other options doesn't show a lot of positive results. These are cases, okay, implant is not placed correctly, a lower left wisdom tooth extracted in an iatrogenic way without studying the case, these positions of the implant. Usually, how do you know? There's numbness, tickling, throbbing, burning sensation, or sharp pain. We know when we have a paresthesia. Of course, it affects negatively the quality of life of the patient, especially psychologically. If you want to take a picture, how do you know if there's an iatrogenic lesion on the lingual nerve and on the alveolar nerve? So these symptoms are for the lingual nerve, and these are for the alveolar nerve, okay? We had an inferior alveolar nerve damage in our case. Surgical methods, as I've said, very expensive, requires a very skilled neurosurgeon, has adverse side effects, and results are not guaranteed. Even with photobiomodulation, results are not always guaranteed. You cannot simulate anything in life, something that is dead. But at least it's not invasive, it has a promising results, it doesn't cost so much compared to surgical interventions. Analgesics or medications are only a treatment for the etiology, so only for the pain, vitamins, etc. So, when I told the patient I will treat him, I wanted to read more about photobiomodulation in nerve injury. So I referred to this article that was published, and in this article they did an in vivo and in vitro study to see if really photobiomodulation can do something in nerve damage, okay, nerve injury. So this is the sciatic crush injury model in rat. On the mouse, he will do an injury and he will stimulate and will compare it to another group, injured but not stimulated, and a conclusion will be made. So he saw I'm really summarizing the protocol. He saw, this scientist, that when the laser is used, the muscle atrophy, so the dysfunctioning of the muscles, is less than control group, significantly less. First conclusion. That's very good because we have muscles here on the lip and etc. In early stages of muscle atrophy, PBM, photobiomodulation, may preserve the muscles. He saw also in a histological study, it's an in vivo study, that photobiomodulation group shows no scars histologically compared to control group. That's perfect also. He showed clinically that the aspect of the sciatic nerve in the laced group are almost the same as one that is intact, okay? So this is a laced group and this is the control group with an injury with no treatment. And we have exactly the same in the alveolar nerve damage. And also, finally, the motor function in a clinical study was significantly better in laced group compared to placebo. Always the same author. Okay, this is MRC muscles. How strong are the muscles? So motor function was way better in photobiomodulation group compared to placebo. All of these are positive in our case because there's a lot of muscles, and this is what the patient is suffering from. His lip, he cannot touch it. When he touches it, he doesn't feel, etc. So these are the conclusions from the previous study, and based on this study and from his protocol parameters, I did exactly the same, but I followed the alveolar nerve. So back to our study. 28-year-old male, after 6 months, severe symptoms post-surgical extraction. He was taking for 6 months all the vitamins that usually are given, Neurobion. Okay, and 6 months and 9 days after extraction, zero improvement of symptoms. This is why I was scared from this case. So, complete numbness of consoidal gingiva and mucosa, contraction of the inferior lip, deep cutaneous pain on the inferior lip, complete numbness of more than half of the right chin, generalized and back pain in the right mandible. As the classifications, the diagnosis was severe iatrogenic alveolar nerve damage during extraction of the right mandibular wisdom tooth. So, this is, in a scientific way, how we would write the symptoms. Lower lip, deep cutaneous pain, and autonomous tone. Chin, no sensation at all. Cheek, no sensation at all. Parameters. Intraoral and extraoral, number of sessions, 42 sessions. Okay. How I was doing it? I was doing 6 sessions, okay, in 2 weeks. And then I will stop. The patient will come. We will do an assessment. If there's an improvement with the cold test on the teeth, by touching it. If there's an improvement, we continue. So we did, I've called this a series. Each series was made of 6 sessions, 6 episodes, okay? And if there is an improvement, I will move to another series of 6 sessions. In total, it was 42 sessions. But there was improvement each series of sessions. So this is why we were continuing, okay? Why I have chosen these areas? Because of the anatomy, alveolar nerve, and the terminal, the muscles that I want to stimulate, and the terminal end of the nerve. You see, we have both tips. with the same parameters, I can just change the surface, change the calculation of the time, and do the irradiation. This is after all of the treatments. So as I've said, S1 is 6 sessions, 6 sessions, 6, 6, 6, 6. And for example here for the cheek, after 3 multiplied by 6, after 18, we started to have a normal sensation. For the lower lip, after S7, we started to have a normal sensation. And everything significantly improved. Just the gingiva and mucosa from the second molar to the canine, it remained with a light abdominal sensation on touching. He can simply not touch it, okay? So, before, there was a complete numbness of gingiva, contraction, huge or big contraction of the inferior lip, deep cutaneous pain on the inferior lip, complete numbness of more than half of the right chin, generalized and vague pain in the right mandibular arch. After our famous protocol, significant improvement, but not a total recovery of the severe symptoms related to the inferior alveolar nerve injury. The recovery started only when PBMT photobiomodulation therapy was applied at 6 months post-injury. He was happy and I was so happy. Any questions?
Is that like any time we can give photobiomodulation?
Anytime?
Means, see, usually they say immediately after injury only
Yes.
it will repair. But later on, after some time, we cannot do anything. That's what we have been hearing about since long time.
Exactly.
So now what you have said is after 6 months also showing the good results.
Exactly. Usually it's better to do immediately for sure. In this case, I had the chance that we didn't do better, that they didn't call me and refer the patient immediately after. You know why? Because after some iatrogenic nerve injury, sometimes, and really you have to understand this, sometimes the body will heal normal without any intervention. So how can you say that there was an improvement from your photobiomodulation? Okay, if someone was sick, after 2 days he will be healed automatically without my intervention. So I can't say that the photobiomodulation is the reason why he had a healing. Okay, but if we are convinced, if the protocol is published and very well known, of course it's better. It's way better to do immediately after the extraction, the traumatic injury. As I've said, in cancer patients, when the oncologist starts to be convinced, they will send you patients to prevent oral mucositis, not only to treat them. So before radiotherapy, they will send you the patient, okay? So, of course, but here, they called me 6 months after alveolar nerve injury, and they asked me if I can do anything. I told them, I don't promise. We will start. We did 42 sessions, 6, 6, 6 we were assessing, and because there was positive results, I published this case series. And everything that I did was based on the study that I've showed you, in vitro and clinical study, of one of the most important authors in photobiomodulation. He's not even a dentist, okay? We saw on rats that there was an improvement of the motor function of the muscles. There was an improvement of the aspect, histological aspect of the nerve. No scars. So of course I will try it on my
Will
patient.
you carry on few more cases or not?
Alveolar nerve injury, this was the only case. Photobiomodulation, each week I have a patient. And dentists, they are referring to me. Oncologists, they refer to me, okay?
So you have seen that lot of improvements in these situations.
Of course, everything that I showed you, of course. And as I've told you, the Multinational National Association of Supportive Care in Cancer, a very, very prestigious association, now they recommend the photobiomodulation for cancer patients, not only me. Why do they recommend it? There's no other options, okay?
What's the interval between the sessions?
Usually to have a, if you don't want to complicate yourself, to have a general protocol, do it each 48 hours. So Monday, Wednesday, Friday.